Well, welcome everyone, and thank you all for attending this fourth installment of Strength and Unity. My name is Luce, and I serve as the volunteer manager for We Are Ill. We're so happy to have you join us here tonight. The space was created for us by us to make sure that we're centering Black folks navigating NMOSD and chronic illnesses with care, respect, and of course, real talk. Again, whether you're newly diagnosed, undiagnosed, but suspicious, or just a long-time driver, this space is meant to belong to you all. So really our goal here today is simple: to focus on building community, sharing truth, and just reminding each other that you're not alone in this. So feel free to use the chat to just connect, ask questions, or just affirm other experiences that you relate to. It's meant to be a safe and welcoming space for everyone here. So let's get started. Before we dive in, I just want to take a moment to acknowledge the organization that brought us here today. We Are Ill. It is a nonprofit patient advocacy organization that focus on uplifting Black women living with autoimmune disorders like NMOSD or MS or lupus. And really our vision is to redefine what sick looks like by making the chronic illness community more inclusive. We have several initiatives focused around increasing Black women's visibility and access to patient care, research, education, and just the chronic illness community as a whole. Okay. Some of the notable offerings we have include first, our flagship event, Wellness Weekend. In its 6th year that we bring together various women together living with MS and chronic illnesses. We also include blogs from influencers about how to live well in spite of MS, and even have different community resources like a private Facebook group and a community meetup. So with that said, I want to take a moment to introduce our facilitator, Dr. Jackie Nolan McEwen. We're honored to welcome Dr. Jackie, a fellowship-trained MS specialist and board-certified neurologist at Joy Life Wellness Group. With degrees from Vanderbilt, Emory, and the Philadelphia College of Osteopathic Medicine, her path blends neuroscience, public health, and deep compassion for the MS community. Dr. Nolan McEwen also serves on the We Are Ill's advisory board. She trained at top institutions across the country, including the Center for Disease Control and Prevention, and bring both cutting-edge expertise and lived experiences to her work. Dr. Nolan McEwen is also known for empowering her patients to take active role in their care and for creating a space where collaboration, joy, and health can thrive. Over to you, Dr. Nolan McEwen.
Thank you so much. Thank you. Hello, everyone. Good evening. I am so happy to see everyone, and I'm really honored to share this space with you all tonight. Whether you are living with NMOSD, if you're caring for someone who has NMOSD, or you're just here simply to learn. I know a lot of times my fellow MS thrivers just want to know more about our almost sister condition. So we're glad to have you here, and just know that you are a part of something powerful here. So let's go ahead and settle in. Let's be present and take this time for ourselves. I I get so excited to do things with the NMOSD community because I feel that the Black community within those living with NMOSD don't get as much shine as you guys should. This is a very resilient community, and we'll talk about some of the similarities between MS and NMO. Of course, completely different conditions, and thus, and those living with NMOSD deserve their own space. So I'm glad that you guys are here tonight to learn more about your condition or just learn more about NMO. I want to jump into introducing our amazing speakers that we're going to have tonight. We have both Monica Jones and oops. Oh, there you are. And then Nawandi Williams. So I'll let you guys introduce yourself a little bit. We can start with you, Monica, if you don't mind. You're on mute.
Sorry. Good evening, everyone. My name is Monica Jones. I am from Norfolk, Virginia, and I was diagnosed with NMOSD in June of 2020.
All right. And Nawandi. Can you introduce yourself?
Take myself off mute. Yes. Hello, everyone. I am so excited to be here with you all tonight. My name is Nawandi Williams. I am a licensed therapist in the state of Georgia. I am also a Black woman living with multiple sclerosis. I was diagnosed November 18th, 2013, to be exact. I am a founder of my private practice, Release to Peace LLC, where I work primarily with Black women doing trauma work and also doing work such as this, helping spread awareness surrounding mental health in within the community of those of us who live with chronic health conditions. So again, I'm just really happy to be here and looking forward to this amazing conversation we're about to have.
Awesome. Well, thank you both. Both of your lived experiences are really, really important. I will share quickly also, again, as stated, I think in my bio, I also am living with multiple sclerosis, diagnosed in 2009. All right. So before we get too deep, I really want to name like, why are we here? We're here because Black NMOSD patients deserve spaces that are made for us, by us, and with us in mind. So FUBU, we're bringing back FUBU. Also, I really want us to get grounded in that truth together. And there are some goals that we have that I would like for us to be able to achieve today. Is for us to just make connections, whether you end up speaking with someone in the chat, you exchange information, or if you happen to know other people who are here in the chat from other events. Again, this is meant to be a stage for us to connect. I want us to leave feeling empowered, to know that we really are out here thriving, and we are women with so many things to offer to our communities together. And this is a place for us, women and men, I'll say, a place for us to be. And then speaking of that is community, knowing that the community is there, and we are really grateful for We're Ill for ensuring that the community is loud and proud for Black women living with NMOSD as well as multiple sclerosis. So when you leave here tonight, I would like for everyone to have felt seen, felt heard, and better equipped to manage your life living with NMOSD. So before we kind of get into talking more about our collective experiences, I want to get the audience involved a little bit. Hello, everyone out there. So just quickly, if you can drop off in the chat, what is one word that describes what community means to you? And we'll be looking down here. All right. Ooh, presence. I like that. Togetherness. Okay. I love that. Similarities. Yes, absolutely. A community is a shoulder to lean on. Unity. Unity. Okay. We have two people saying the same thing. I love that. I feel like everyone is kind of along the same things of I'll take Brandy, your word, just togetherness and those things that do bring us together and help us feel comfortable with each other. Anyone else? All right, so we're going to talk a little bit more about kind of Nawani and Monica, what that means to us. But just to set the tone a little bit more, we're going to jump into getting some real life wisdom. So the next conversation, I want us to feel like we're sitting with friends that you trust, because we know that sometimes healing actually starts when you feel like you're being seen and heard. Assistance, I see that one last thing popping up. I love that word as well. So let's jump a little bit into it, and I want to kind of put this towards both you and both Nwani and Monica. But Nwani, when you hear the word community, what comes to you personally?
Yeah, a few things come to mind, but I think the biggest word that comes to mind when I hear community is refuge.
Hmm.
I think in community there's covering.
Okay. Yes.
And so
I always remind myself that we were never meant to do this life alone and that we're wired for connection. And so, especially, with being Black women, um, there's a lot of places on this earth where safety is just not a thing. And so when we have safe community, I think of being covered and being seen for where we are in whatever stage of life that we're in, and vice versa for us to see other people in our community as well.
Absolutely. I love that when you first said covered, safety was the first thing that came to my mind. So for you to
Yes.
bring that word up later, I absolutely agree with that. What about you, Mo? Or do you want me to call you Mo or Monica? Mo, okay.
Um, for me, it's support, but not just support, it's understanding, it's, love, it's grace. A lot of times when someone isn't going through, not even necessarily like the same disease as you, but just being chronically ill in general, they don't understand. They don't have that understanding. We can't do all the things that we once were able to do, and they see us and we look okay, but, just because we look okay doesn't mean that we feel okay. So just having that support and that understanding and that love and that grace to know that, if we're doing something, it may have taken us a lot to be able to do what we're doing. And after that's done, we if that may be it for us. And just understanding that that's kind of what comes with being chronically ill.
Absolutely, absolutely. And would you mind sharing a little bit more about your story, about your diagnosis journey, and then with that, how did the journey kind of prompt you to build or find your own support network since you've gotten your diagnosis?
Absolutely. So I've had symptoms as early as 2002, 2003, but I never knew what it was. And eventually in 2015, I was diagnosed with fibromyalgia, but I still kind of felt like that was just a throwaway diagnosis because they couldn't really find anything else at the time. And eventually on June 14th of 2020, when I lost my vision, that's kind of what prompted them to dig more into it and try to see what was going on. And that experience within itself, just from the day that I went to the emergency room and I told them that what was going on. And I live in an urban area where, a lot of people are considered to be drug seekers, or, a lot of homeless people will go to the emergency room just to find shelter. And so I was kind of thrown to the side with it. The first thing they did was drug tested me. The neurologist well, not the neurologist, but the doctor that was on call that night, who was also a person of color, I heard him tell his white counterpart that he didn't feel that the testing that the neurologist ordered was medically necessary. And shortly after he said that is when I lost my vision.
Mm.
Um, and even after I lost my vision, I still sat for another 4 hours waiting for something to be done, only for them to tell me that their MRI machine was broken and they were transferring me to another hospital. So my first part of that experience didn't go well. When they transferred me, they hopped right into motion, and I was fortunate because my husband has a cousin who is a pharmacist and happened to work on some of the NMO drug trials. And when she heard my symptoms, she had them test me for it. And although I did not test positive, because of the symptoms I was having, that's how I got my diagnosis. And from there, one of the main things that they tell you not to do is to Google, because Google will have you on your deathbed with everything wrong. But when it's something you haven't heard of, you want information. And so, of course, I did Google. I thought I was going to die within 5 years. I thought that I was going to be paralyzed. I was going to go completely blind. But through that, and through me telling my story, that's how I kind of found my community. People saw my story. I ended up starting my own business. I started a candle business because I knew life for me and the workforce for me was probably going to be different. And I needed something that could accommodate my lifestyle and my new health issues. And people read my story. There was a local story done here with a local newspaper, And from that, people from NMO organizations found me, and that's how I found and built my community.
Wow. Wow. That's so impactful. And I the more and more I hear your story, the more I'm just astounded. And it's I love how you say that your community found you. Because it's not always where we actively go out seeking, or we might not be in that process in our maybe grieving state when we get newly diagnosed. So however it comes to you and however you find it, we know that it's just meant to be. And look at you here today. It's awesome. So that kind of blends into a little bit of what I want to ask you, Nwandi. To you, what does a strong support system look like for someone who's newly diagnosed, and how important do you feel that is to have one?
Yeah, support is such a critical link. I think a strong support system, when I think of a strong support system, I think of quality over quantity.
Mhm.
Having quality people who, like Monica Mo said before, um, who not only want to support but also want to understand. I think that is a really powerful shift in thinking. Um, when I think of, the importance of a support system, there's lots of research out there that supports the notion that having support is directly linked to the alleviation of depression and anxiety.
Mm.
So, I think a lot of us who are living with any kind of chronic health condition, there can be a lot of shame attached to that. A lot of our anxiety stems from uncertainty. We don't know what life will look like. We're concerned, how are people going to view us now? And so when we find ourselves in community, with the right support, being able to be seen
Yeah.
for who we are, truly where we are, highs, lows, ups, downs, ins, outs. There's a power in that, and being able to not only be seen in that space, but also to let people help us and
Mhm.
support us in that space.
Yeah.
So strong support system, is critical, I think, in this community.
Absolutely. Absolutely. And it kind of shows how you said the importance of not necessarily always turning inward and handling everything on your own, but it's really beneficial. And there's clinical data to show, the importance of learning to lean on your support system, on your community.
Yes.
Mo, what role would you say that your friends, your family, or even online communities play in helping you feel understood and connected?
Um, I think at first, for some of my friends and family, it was hard for them to understand because I was always superwoman. I was always on the go. I was working multiple jobs. I was in school. And to see me slow down like that, but to still kind of look like my normal self, it was hard for them to understand. But as time went on and they saw physically, like, yeah, I'm go, go, go. And then the next minute I'm down, they're like, oh, okay, like even though she looks okay, she's really not. And so now they take the time, even when I try to say, oh, I'm okay, let me do it, let me do it. They're like, girl, we see that you're not okay. So just let us help you. And that was hard for me too. When you're chronically ill, you still want that semblance of normalcy, um, whatever that may be. And it's hard to kind of relinquish that because you still want to feel like your old self. And unfortunately, some of our old self leaves us. And so my support system is very small now. Unfortunately, when you get chronically ill, you sometimes have a tendency to lose friends, or family members tend to stay away because there's always something wrong or you always don't feel well. But I would say that between my small circle of friends and family and with my NMO, some people in the NMO community, that's where I've found my safe space and my most support.
Yeah, yeah. I'm curious with both of you after your diagnosis, how did you find yourself again? Because I know in that moment with your diagnosis, there's so much going on, but how did you get back to you and kind of redefine who you are? A lot of times we want to say, oh, MS does not define me, but or NMO does not define me, but it's a big part of who we are. And so how did you find yourself again?
I'm still looking, actually. I think one thing that's not talked about enough is the grieving period. People feel like, okay, you got the diagnosis, you know what's wrong, and so now you should be okay. No, it doesn't work like that. So I still think that even though it's been 5 years, I'm still in my grieving period. But I think what helps is that my family and my friends have also kind of found that balance. Like I tell them, let me try to do things on my own. And if I can't do it, then I'm gonna have to tell myself, let them help. Or, I can't always try to be superwoman because that does also hurt. It's not always helpful to try to be who I once was. But I think I'm slowly finding myself. I'm getting back into doing things that I did before. There was a period where I didn't want to go out. I didn't want to be around people, um, because I felt like if I go out and then I'm suddenly in pain, then I'm going to ruin everybody's time. And my friends are like, stop doing that. If you can't do something or you don't feel good, you sit your behind down somewhere, and it's okay. And so I think that's part of what's helping me get back to the person that I was. And I very much appreciate that because it takes away some of my guilt too from not being able to do all the things that I was once able to do.
Oh, wow. Yeah, guilt. That's a heavy thing. The guilt that you have from something that you didn't even ask for. That's crazy. And I want to kind of point out really quick before I ask you, Nwandi, Tony Washington in the chat, he said, he or she, I'm sorry, and the spelling, I'm assuming he, I believe to have a good support system, a major part should be understanding and patience. So it's kind of going in line with what we're saying. But what about you, Nwandi? How did you find yourself?
Like Mo, it's a daily journey. It's a daily journey. I think a big part of what I have had to learn, I read an article a few years ago that was talking about grief, like Mo was just talking about, and it was saying how, you know, we grow around grief. So it's
Mm-hmm.
like you have grief and then you have you, and we just learn how to integrate it into our lives on a daily basis. It's not something that goes away. It's just something we learn how to navigate.
Right.
So I think that has been a huge piece for me is embracing the fact that grief is just a part of life right now, but so is joy,
Mhm.
and that both of them, I'm vast enough, we are all vast enough to hold both of those truths at the same time. My grief does not cancel out my joy. I can still remain open enough to figure out who I am now, 10 years from now, 20 years from now, in community, being in spaces like this where I can look at Mo and I can look at you, Dr. McEwen, and say, okay, they're doing it, right? They're living life. I can too. And so, yeah, I think it's just a journey. I don't know if we'll ever be like, okay, I have found myself. Here
Yeah.
I am. It's like, well, no, 10 years from now, it's gonna look totally different. And I'm okay with that.
Absolutely. And
Mhm.
looking in the panel, in the chat, Brandy said that grieving is definitely ongoing because both NMO and NMS changes, symptoms may change, and then the process kind of starts all over again. That's powerful, Brandy. Absolutely. And Nicole said I had to educate myself, then educate my community so they could and can support me and my family as a caretaker of a then 5-year old with these symptoms and this unknown illness. Wow. So that brings us to kind of just, we've talked about the healing aspect of it and the importance of community. So, to both of you, what does community healing mean to you, and how can we foster it for Black women living with NMOSD?
Well, for starters, I think forums like this are one of the biggest things. Being able to see, you know, in the NMO community, there. there are a lot of people of color, but the research doesn't really support people of color. And so having forums like this with people of color where you can see, okay, so there's other people of color that are going through what I'm going through. I not that I don't understand what the non-people of color are going through, but I need to be able to find people like myself who I can relate to and who I can see are thriving. I met at my very first patient day with the Guthrie Jackson Charitable Foundation, who I'm also an advocate for. I met a girl from South Carolina. I love her to death, but she is from a small town in South Carolina. There's not, you know, big medical places, and she didn't know anybody else with NMO, which I didn't either until then. Um, but to see that there are people with NMO who are doctors or who are in school and who are working, you know, she was diagnosed with NMO in I think 2009, and she had never had a real job. So she
Yeah.
didn't know that you could still thrive even though we have this disease that's so bad and that's ever changing. And, you know, from one minute to the next, you don't know if you don't, you know, I'm scared. I could wake up tomorrow and I could be completely blind or I could be paralyzed. Like you just don't know. But to see other people like you who can give you that hope, I think is very healing. And it gives you hope that, you know, every day is not going to be a bad day, that one day you'll be able to do the things that you want to do. And she has come out of her shell so much just from being around other patients like her. Now she's advocating and she's speaking out because she's one of those people. If a doctor told her something, she was going to go with it. I told her, girl, if a doctor tells you something and you don't like it, you fire them and you find somebody else. And
Absolutely.
now
Mhm.
she's quick to do that. If she doesn't like something her doctor says, I'm gonna find another one. Or she'll call me and she'll be like, what should I say? And I'll tell her what to say. And she'll be like, girl, I told them I'm gonna find. I said, thank you. And I think that's very much needed.
Yes, absolutely. I am quick to tell my patients, I don't know it all. I don't know what's going on. If I don't know, let's get a second opinion. And unfortunately, not all doctors are that way. So, we have platforms like this, and that's mentorship, in a way that you maybe didn't even see coming, but you mentored this young lady to learn how to better advocate for herself. So, that's awesome. And this is what this is about, for us to be able to do that. As we learn, we can share with those, you know, I don't want to say who are coming behind us, but you understand what I'm saying. I want to get the audience back involved a little bit. Have you all found it easier or harder to talk about NMOSD with family and friends? Why or why not? I feel that from an MS standpoint for me, I'm okay now because I have the knowledge from a physician standpoint. But when I was in grad school and in medical school, because we learned what MS was, but you don't really learn it in medical school. I didn't fully understand until I was in neurology residency. But at that time, talking with my family, I did sometimes, I can't remember which of you said it, but I was sometimes avoid maybe talking to my family about it. And I remember my dad, he would ask all the time after an appointment, what's your MRI look like? You have any new lesions? Are you having anything new? And I was watching you the other day and your hand was shaking a little bit. Like, are you okay? Are you taking your medicine? I was not, but that's another story. Don't do as I do, do as I say. But those are the things where sometimes I felt that it was just harder to connect with my family, and because I don't think I had the knowledge to fully share with them. And at that time, this is 2009, 2010, I was diagnosed in '09. Like I said, the community just was not there, and I didn't have a patient day to, go with my family and my friends so that they could get a better understanding. So, um, those in the audience, over time with you, again, have you found it easier or harder to talk about NMO? Or Mo and Awandi, anything that you guys have to add while we're seeing if anyone else wants to share?
I think now, as time has gone on, it's easier for me. I talk about NMO any opportunity I get because it's not as well known. And, for a while, I would just tell people I had MS because it was easier for people to relate to that because they understand it was more well known than NMO. But then as went on, I was like, well, no, I'm not going to say that anymore because even though there are some similarities, it's not the same. And I need people to know that there are differences. But there's still days where, the days where I don't feel good. And, if you say NMO and then you get 50,000 questions after, well, what's that? And what do you, I mean, sometimes I still do it, but I try not to make it a habit. Because I feel the more that it's talked about, the more well known it will become.
Mhm.
So it's easier now to talk about it versus when I was first diagnosed because everyone had questions when I first told them, well, what is it? Well, what's wrong with you? Are you gonna die? Like you don't want questions like that when you're first diagnosed because you're still trying to navigate through it yourself. But I feel like for anyone, as time goes on and as people see other people talking more about it, it'll become easier for others to talk about it as well.
For sure. I agree with that. And Denma, I hope I pronounced your name right. Said, I think it's always hard at first because you're trying to grasp it for yourself. So literally what you just said, Mo. And then if you don't talk about it as much, it's not real. Okay, good. I pronounced your name right. And then Nima said, my mother and I are both nurses, and that didn't even help with making it easier at first. But now it's easier to talk about it amongst my immediate family, but not my community, which I would like to be more open. Hopefully, this can help with that. And Nicole said it's been easier, I think, because my young daughter was the patient. We started with ADEM, then CIS, and now MS. People were surprised that she had this illness because my daughter functioned as a normal kid. Unbeknownst to us, swimming was a saving grace. Oh, that's awesome. That's awesome. All right. Well, I think that's kind of a good segue into us. This is all amazing and powerful. That information and knowledge is key. So I want to make sure that before we go forward and have more discussion, that everyone feels like they are equipped with the right information, because we know that knowledge is one of the ways that we actually can protect ourselves. It allows us to, again, better advocate for ourselves and for our loved ones. So I'd like to share some key things that every Black NMO patient should know, and we're going to keep it nice and simple. So some of the slides are going to have a lot of information on it, but I'll keep trying to just kind of break it down a little bit for you. All righty. So just talking a little bit about the history of NMOSD. So with NMO, for the longest, we thought that it was just a subset of multiple sclerosis. Now, when we look at literature, it was actually described and recognized in literature way back in 1894. But still, amongst the kind of the neurology community, it was thought that it was just maybe a portion of MS that maybe affected your spinal cord or your optic nerves a little bit more. Fast forward into the 20th century, there were ideas that, maybe rather than someone just kind of having one episode, this was something that we could see continuous relapses if not treated. And then it wasn't until 2004 that an actual antibody for NMOSD was found, so aquaporin 4, it was discovered. And then it wasn't until 2 more years, in 2006, that it became more widely available and was actually added to the diagnostic criteria. But as we know, with Mo, not everyone does test positive for this antibody. So we really do go a lot off of symptoms and presentation. And I'll talk a little bit more about the way lesions in the brain and the spinal cord look, that can help us separate NMOSD from things like multiple sclerosis. So it became known as more of like a spectrum disorder in 2007. And then we have all these years of, using medications off label to treat NMO, using steroids and a lot of different things. And then in 2019, we had the very first FDA approved treatment for NMOSD. And that has literally kind of changed the landscape for a lot of individuals living with NMO. So where does it all fit in? So like I said, after all of these years of us, not necessarily knowing that there was something different. Over time, they were able, with autism, not autism, excuse me, autopsies, able to look at the actual pathology of what lesions look like in those who are living with NMO, or those with MS. And eventually we're able to find that those lesions look very different. There's a completely different process deep down when it comes to NMO in comparison to MS. With NMO, and a lot of times of why the intensity of a lot of the relapses that those living with NMO have, is because of the severe impact on your actual nerve. So it literally kind of lyses and dices and kills off those nerves, rather than with multiple sclerosis, the immune system is just kind of attacking the wrapping around the nerve cells themselves. And also, we can see similar things in regard to kind of where NMO impacts in the body, in the brain, the optic nerve, and the spinal cord. But I'll talk a little bit. I want to show some additional images again on kind of what those differences and stuff are. But learning the way that it looks different under the microscope, and the way that the cells reacted, and how they were treated, that let us know that this was a completely different thing than multiple sclerosis. So we see NMO primarily in females, so 70 to 90% female predominance. There in children, though, there does not seem to be a gender predilection. Age of onset is going to be a little bit higher in NMO. So age of onset in the 30s and 40s versus with multiple sclerosis. And this is changing now a little bit, I think, as well. But traditionally with MS, age of onset is typically more in your 20s. And then children and elderly account for about 18% of those that are living with NMO. About 80% of people will test positive for that antibody, so aquaporin 4 antibody. But again, we have Mo right here. Not everyone is positive for that. There is not a necessary gene that we know of that says, okay, you are destined to get NMO. But we know that there are different genetic susceptibilities that can increase your risk of getting it. And then if someone in your family has NMO, or honestly any other kind of autoimmune condition, then increases your risk by approximately 3% of then to go on at some point to go on and develop NMO. So here are kind of the major things that we look at as far as and what's important. And I think the take home I want for you to understand and recognize that how things can present. So then that way, if you have a loved one that has similar symptoms, you know to kind of push for them to get additional imaging or further testing. I'll quickly go back and tell kind of my story. I was diagnosed in 2009, and how old was I? I was 21. I was 21 at that time. But when I was in high school, my freshman year of high school, I was in band class, I'll never forget. And I had sudden onset of double vision. And I realized that it was kind of primarily from my left eye. One of my friends told me that my eye was not moving outwards. And so ultimately ended up going to the doctor and was diagnosed with what we call a sixth nerve palsy. So the sixth nerve allows your eyes to move lateral or outside. I only had a CT of my head, and my parents were told that it was likely a virus that was causing this. And I don't think I was given steroids. They just said, have her wear an eye patch and it'll improve on its own. If my parents had been aware of MS or NMO or anything like that, they may have pushed more to say, no, let's look into this a little bit more. Can we have at least an MRI to see what else is going on? So again, awareness in our community and knowing kind of what type of symptoms that these conditions present with is really important. So who knows that was my first symptom? I think it was. My optic neuritis was also in my left eye. That was what led to my diagnosis. So who knows, but we don't want to make these same mistakes going forward. So in regard to NMOSD, a lot of times people will present with what we call a transverse myelitis. So that is when you have inflammation in the spinal cord. So it can cause spasms. You can actually have weakness, loss of sensation in your limbs. The weakness can be so significant that people are paralyzed. Depending on where the lesions are, you can have loss of bladder or bowel function. Now, the thing that separates this, because you can also see transverse myelitis as an initial or a subsequent relapse with multiple sclerosis. When we look at the MRI, the lesions are longer. They're what we call longitudinally extensive lesions, where the lesion will cover more than. I am so sorry, guys. I should have put my phone on silent. I apologize, where the lesions will cover more than 50% of the spinal cord, and usually it's going to be more centrally. So if you see here in the picture here, the kind of bright fluffiness in the middle, so that's where the spinal cord is. That's the lesion, and it covers a lot of different of the vertebrae, and it's long. And with multiple sclerosis, typically it's going to be more patchy, and you'll see it spaced throughout the spinal cord if it is there. Another thing that's very classic for NMO that we can see with multiple sclerosis, but we would see a lot of it with NMO, is optic neuritis. So optic neuritis is when you have actual inflammation of the optic nerve. So if you see in the pictures down below, the optic nerve is attached to the back of your eyeball. And if that nerve gets inflamed, it kind of swells a little bit and it can affect your vision. Most of the time, the vision loss is going to be more central, but they can lead to actual blindness. And we typically see more blindness with NMO in comparison to MS. And the reason why is, again, like in the spinal cord, where we saw that the lesions were a lot longer in association with NMO, the lesion that we see in the optic nerve, when the optic neuritis is secondary to NMO, that lesion is a lot longer. It encompasses more of the optic nerve, and that can affect more of the vision versus just the central vision and can lead to total loss. Responds well to steroids, but we don't always see as much recovery with optic neuritis with NMO in comparison to what we see with multiple sclerosis. Another thing that separates optic neuritis and MS and NMO is that a lot of times optic neuritis can be bilateral or in both eyes for those living with NMO. So it can be in both eyes in one setting, or you can have kind of recurrent episodes of optic neuritis. With multiple sclerosis, a lot of times we typically don't see that. We'll see it at one time in one eye, and we don't usually see a reoccurrence in the opposite eye or even a reoccurrence in that same eye. So a little bit a separate thing there. And then there are other things. Now, this is hallmark to NMO. We do not see this with multiple sclerosis. There is an area within your brainstem that if you have a lesion there, it can cause symptoms such as intractable, meaning that you can't get rid of them. They keep going. Intractable hiccups, nausea that you can't control, vomiting that you cannot control. So if I see someone, they have a history of optic neuritis, we treat them for their optic neuritis, brain looks okay. And so we're like, oh, not quite consistent with multiple sclerosis yet, but we know something is going on. We're going to monitor you closely. And then I see them back in a couple of months or a year or so, and they are having hiccups that they can't stop and nothing is helping, like days of hiccups. Then automatically I'm going to think NMO, and I want to re-image and check for that antibody. So before I talk a little bit about this, another thing that sets a little bit a difference between NMO and MS and how it looks is from a neurology standpoint. When we're looking at your MRIs, we tend to not see as many lesions in the brain in those living with NMO, and they look a little bit different. They might be a little bit more fluffy, or they're in particular areas of the brain, like I said, in the brainstem around that part of the brain that can cause the intractable nausea and hiccups. With multiple sclerosis, you're more than likely to see more lesions in the brain than you would anywhere else. And then again, we already talked about how in the spinal cord, you may see shorter lesions in those living with MS and then longer lesions in those living with NMO. But regardless of all of that, comprehensive care is going to be really critical to creating a patient-centered team approach with getting the diagnosis and then treating. I'm very big on, I can treat if someone has maybe urinary retention, meaning that you can't fully empty your bladder, or if you're going to the restroom too frequent, or you can't make it to the restroom in time because maybe of a lesion in your spinal cord, but that's not my area of expertise. I will refer you to a pelvic floor therapist pharmacist or to a urologist in a heartbeat. Also, we've already talked a little bit about just like in that initial stage of when you're getting diagnosed, rehab may be something that's necessary, physical therapy, occupational therapy, and getting in contact with a mental health professional to also help guide you through the grieving process. A pharmacist who can help us to explain the medication even better than we can. It's really important to for us to come together so that we can communicate, which will optimize care and overall enhance quality of life. So once we've built that team, then we can kind of jump into how do we treat NMO. So with relapses, a relapse is when you have an onset of neurologic symptoms that are lasting greater than 24 hours. And over this 24-hour period may kind of get worse and then maybe reach a plateau and maybe get a little bit better or stay consistent there. In this acute setting, we treat with steroids. Sometimes, especially with NMO, if someone doesn't respond as well to steroids or you have a history of not responding as well to steroids from a prior relapse, then we'll use things like plasmapheresis or plex or plasma exchange. There's a lot of different words for that. And a lot of times, honestly, I do feel that plasma pheresis actually works a little bit better with improving symptoms at a more quickly and at a higher rate with getting someone closer to their baseline. So sometimes I just jump right to it depending on how severe the relapse is. We also know that untreated NMO is at a very high risk for relapses. So the difference between the disability that we see in someone living with MS versus someone living with NMO. Multiple sclerosis is a progressive condition where you can have progressive worsening of your symptoms or progression of disability that increases over time, regardless of being on medication or different things like that. With NMO, relapses, the relapse itself can be the disabling feature for someone. In between a relapse, we do not see progression of the condition. We don't see continued inflammation in the brain or in the spinal cord or the optic nerve. It's just going to be in those immediate things. And then the response that someone is able to get in regard to plasmapheresis or steroids, physical therapy, that is what defines kind of if there's going to be any level of disability left over. So if you have any questions about that, drop it down. I know that can be kind of a difficult thing to understand, but again, with NMO, it's the relapses that are the things that we absolutely want to prevent because that's what can cause the disability. We want to prevent it in MS as well, but we also want to look at a bigger picture because there can be things in between relapses. Also, we want to make sure that we are fully differentiating if someone has NMO versus MS because some of the treatments we use for multiple sclerosis can actually make NMO a lot worse. So some medications, and we don't use these anymore, but they were widely used when I was diagnosed in 2009, or beta interferons, fingolimod, glatiramer acetate. So you guys understand a little bit more. Gilenya, Copaxone, Tysabri. These are medications that we can use in multiple sclerosis, especially Tysabri is a highly used medication for MS. That if we use it in someone who has NMO, it can make their activity increase and can cause more disability. So it's really important for us to make sure that we don't get this mixed up. So like I said, we now have FDA approved medications for NMO. Previously, we used a lot of steroids. We use medications such as Rituxan or rituximab. So all of these things were off label, but now for seropositive, and we figure out a way to get everyone on the medication that they need to be on. But there are approved therapies for seropositive NMOSD. This one has 3, but there are actually 4 now. So we have come a long way. And again, I definitely feel like it has changed the landscape and will change, in my opinion, the natural course of NMOSD in various communities. So what do we do now? So we know that there is an unrecognized burden of MS in the U.S. Black community, but there is a recognized burden of NMOSD in the U.S. Black community. So we know that Black individuals are the I guess the population that are more likely to get NMO, as well as Asian communities. So we know that the burden is there, but at this time, like Mo alluded to a little bit earlier, there's the research is not showing the significance of NMO in the Black community, and that's what we need to change. So we need to inform, we need to educate, find that support amongst not all neurologists specialize in recognizing NMO or MS. So within my physician community, educating each other, and then also educating family physicians. And then making sure that we have the production of culturally competent videos, programs like this, appropriate media coverage. I don't want to see only commercials about NMO with a with a white man in it. I need to see some black people in these commercials. And also increasing diversity in clinical trials. In all of these medications that I just talked about, or the table that I just showed you, less than 5% of people who were in those clinical trials were black. And so, but yet we're using these medications to treat a predominantly black condition. So we need to show up and increase diversity in our clinical trials. So I want to move on to that. So kind of taking all of this into mind, your own kind of understanding that you had of NMO, what's one thing you wish that your healthcare provider explained better about NMOSD for you? And while you guys are putting that in here, Nicole asked a question, how do we get in these commercials to show our beautiful Black and brown people? Well, we know we have organizations like We're Ill that are working to address, even when you look online and you type in NMO and, you might be presenting, you might do you might be at a school and talking about just your lived experience, and then you look online and you don't want to put your picture there, but there's no other pictures online that of someone that looks like you. I know that We Are Ill is working to kind of have these areas where you have kind of pictures and videos that you can use, that can be used for commercials, that can be used for medication pamphlets and things of that nature. So organizations, can help with that. Mo, Nwandi, anything else? Mo, anything that you've come across with, the organizations you're involved with?
Um, I know Guthie is pretty good with trying to like encase and showcase everyone. I know some of the bigger pharmaceutical companies like Amgen and Alexion, they have had some people of color in some of their commercials and some of the things that they have put out. Um, I think it's just kind of, the more well known you make yourself. Like a lot of our advocates for Guthie have been in commercials and they're people of color. When they see you putting stuff out and advocating, they tend to reach out to you and pull you into to some of the things that they're doing.
Agreed, agreed. That's been my experience as well. Nwandi, anything that you've experienced within the MS
Um,
community?
I actually just did an interview with I believe the RC Horowitz. They do a lot of like research interviews with people who live with MS. And this specific interview was about marketing and commercials. And I was like, where the black people at? So so hopefully I spoke up about the lack of representation in the commercials that you were showing to me as a Black woman. I mean, the concepts were fine, but I was like, we need some more representation. So what I'm hoping is they're taking that into consideration. And so we'll be able to see more of us.
Absolutely.
These
So the
commercials.
work is being done. Is there are attempts to change this, and if anything ever comes your way, if you see anything, Nicole, jump in there.
Yes.
If you want, get your daughter involved. Especially with the I'm not sure of her age now, but within the pediatric community, I think that would be amazing. Jackie Johnson Collins Nwandi asked, what was the name of the organization you interviewed with?
I am going to make sure I have the name right. It's called RC. I'm gonna find it and I'm gonna put it in the chat because I want to make sure I get it right.
Yes. Yes.
Okay.
Perfect. All right. Well, let's kind of move on. I want us to take some time to also continue to build together, continue these conversations. This next part of our discussion is about lifting up our own voices. And we want to learn more from each other and share what has kind of carried us. So, again, continue to feel free to drop your thoughts and questions in the chat. I love how involved you all are. We really appreciate it. Because, again, this is not a lecture. I'm done with my speaking and my teaching. This is now, more conversation. So let's jump here. Mo, can you talk to us a little bit about what does self-advocacy look like for you when you're navigating your appointments or just treatment decisions?
So for a while, when it came to medical professionals, I was very timid. And it's because, number one, they can be intimidating, but number two, I feel that people of color and more specifically women of color kind of get the short end of the stick. We're seen as we're supposed to be so strong, or we can be over exaggerated. But it for me, I got to a point where I just had enough. It took for me to lose my vision for people to start hearing me. And then from that point, I just said, doctors are not always right, because for years I had doctors telling me there was nothing wrong. And now here I am, something is wrong. So I was right all along. There was something. And so I just had to put my foot down and stand up for myself. If there's something that I don't like, then I will just find another doctor. And, they can call it doctor shopping or whatever the case may be. But one thing for me is that I already have a pharmacy at home. So I'm not going to go shopping for any drugs from a doctor. I don't like to take half of them, because what they don't realize is they want you to be on all this medication, but I have children at home. I have to be able to function. I don't want you to throw drugs at me and send me on my way. I want you to find things for me that I can do and still function as a person, as a mother, and as a wife, and be able to take care of my household. And I had to tell my friends too. I said, if a doctor tells you something, you are entitled to get a second opinion. You don't have to go along with what a doctor is telling you. And and I think another thing is that some doctors, especially some of the older school doctors, have this mindset where a disease will only look one way. This is what they're used to. It's only this, and this, and they haven't seen anything else. So if you come with something else, it can't be that. Five people can have the same illness and have different disease progressions or different symptoms. Not everybody is the same. So just because I'm coming to you with something that you haven't seen before, or something that is not common, doesn't mean that it's not true. And so I will ask other patients their experience as well. And I'll take that to my doctor and I'll say, well, you told me that this isn't the case, but I talked to so many other patients and they're all saying that they experience the same thing as me. And I put that in front of them to try to get them to research a little more. Well, maybe I need to open myself up to new things, because medicine is forever changing. You are practicing medicine, which means that medicine is constantly changing. It's not always going to be the same. And that's what I tell people.
Absolutely, absolutely. I had a very humbling experience just this week. I have a patient that I've been seeing for maybe the last 2 months, and the patient came to me with spasticity in her leg, and the way that she presented it, everything happened after surgery. She had a prior surgery, like now talking about, I'm like, duh, Jackie. But she had a prior surgery where after the surgery in her legs were really spastic, and she was able to kind of recover, regain her strength with a lot of physical therapy, but it took some time. And so I was like stuck on your surgery. This is your surgery did this. This is why your legs like this. This is weird, but I don't know what else could cause this. I looked at her lower back. I was like, okay, well, maybe you have a pinched nerve there. It's causing this, to come down your leg. She did on the left side, but not enough to contribute to both legs. But still, in this moment, now in retrospect, I'm like, oh, but in that moment, it didn't come to me. So I'm like, I'm sorry, I don't know what's going on. Let's get a nerve test to get a little bit more information. Let's send you to physical therapy and go from there. And so her physical therapist, one look at her said, I don't know. I don't think that this just came from your surgery. This looks like what I've seen with other MS patients. I think that maybe you should have your doctor get an MRI of your brain. I'll be honest, she came to me or she sent a message. She was like, my physical therapist said that I should get an MRI of my brain. I was like, okay, I'm not gonna tell you no. If you want it, we'll get it. And to my surprise, this week when we went over that MRI, she had lesions in there consistent with MS, and some of them were enhancing, active lesions. And so it took me back, and I'm just sitting here and I'm like, well, duh, this what else could cause this? And after an accident and after surgery, like those are high stress times when you can have a relapse. Like, why did it not, dawn on me? So it does sometimes take, for you to keep pushing and advocating for yourself and for others, to talk to you and be like, hey, I've seen this, you should ask about that. Or, talk to another doctor who might know you and like, no, this is so different from the person that I knew 5 years ago. Go back to your doctor. So we get humbled and I apologized and jumped right into education and went from there. But we have to still again be open to listening and again continue to advocate for ourselves. Speaking of kind of those appointments and the things, Nwandi, how would you recommend that patients prepare for meetings with their specialists so that their voice is heard, especially when you're really anxious or, you're being kind of told like, yeah, this is from something different. This isn't what you think it is.
Yeah. So the first thing that I would recommend is finding a way to ground yourself before these appointments. They can be, like you said, Dr. McEwen, they can be very anxiety invoking, like you just sometimes I walk into the Shepherd Center and I'm just like, oh my gosh. And I've been going for over 10 years. It's right. So grounding yourself, whether that's through some deep breathing or some meditation. Sometimes I'll call a friend before I go in and just kind of have a few laughs. So I'm kind of lighten me up a little bit. So whatever prayer, whatever that looks like for you. Also bringing your questions or like preparing your questions or preparing whatever you want to discuss. We all know, I'm sure, that once we get into these rooms, sometimes it can be so fast paced and you're kind of like, it just gets very discombobulating sometimes. And so I think having those questions ready or having those symptoms that you want to talk about ready can kind of help alleviate some of that anxiety. And then you're not leaving your appointment like, dang, I forgot to bring up those hand tremors I was having last week, right? Bringing support, bringing someone who you trust with you. It never hurts to have a second set of eyes and ears. Again, I might forget to bring something up. And my mom was like, girl, remember you were telling me last month, bring it up. And I'm like, oh, okay. I forgot. Okay. So having an extra set of eyes and ears and someone who can speak up for you when you may not be able to. I think
Mhm.
that's really, really important. So yeah, oh, tracking your symptoms is something I talked about on the last webinar. Huge, huge thing. Track them so that you can come with your little black book, your little pink book, or whatever color it is. Say this is when I had this hand tremor or this headache, or I was experiencing this nerve pain. So yeah, I think those are the things that I ground yourself, bring a support person, track your symptoms, and prepare your questions.
Yes, I fully agree. That's one thing I also will tell my patients and to use Victoria, her term, being a professional patient.
Yes.
So
Yeah.
with that, and that's kind of a little bit of what I want to ask you, Mo, 'cause I know that that was something that you had to become. But can you give us some tips that you've developed with your journey living with NMO of how you ask questions or speak up when you are feeling dismissed?
Well, my symptom tracker is right here because I don't leave the house without it. So I have a note specifically set for my doctor's appointments, and I track my symptoms and I put my questions there when something happens. Because I remember one time I went to my neurologist and I was having this itch, and it was like this deep under the skin itch that I just couldn't get to, and I couldn't understand where it was coming from. And I asked her if it was a symptom, and she said no. And she's like, I've never heard of it before. It's not. I'm going to send you to a dermatologist. Went to the dermatologist, they prescribed something, but it just couldn't get to that itch. So when I went to a patient day, which is for anyone that has NMOSD, if you have never been to a patient day, I would suggest you go to one because they have some of the professionals who are experienced in NMOSD, and you have the opportunity to ask them questions that your neurologist may not have, because not all neurologists are NMO specialists. And that's your opportunity to ask questions and get the answers that you need that you may not be able to get from your own doctor. And I asked them, I said, I have this itch. It's under the skin, but it's not an itch that can like be easily satisfied. It's not easy to get to. And I was like, is that a symptom? And they were like, absolutely. And I kept pressing it. I wasn't just going to take what my doctor said, because once again, I asked other patients and they said, yeah, I have the same thing and I don't know what it is. And I asked and they said it's called a neuropathic itch. So, it's really just being able to not go with the flow. A lot of people, like I said, doctors can be intimidating. So they'll ask a question, the doctor will answer and say no, or whatever the case may be. And they'll just go about their business, but they still don't have an answer and they still have those symptoms. You have to be able to speak up for yourself no matter how hard it may be, because if you don't, doctors will run over you. I hate to say it, but some doctors will run over you and you're left unsatisfied. You're left with unanswered questions. And you're going to suffer for that. If you don't get the answer to a question that you need and you still have this symptom, you can't figure out what to do for it, you're going to suffer and you're going to hurt yourself more. So I always tell people, hey, if you don't know how to ask the question, if the doctor will let you, you can call me and I'll ask it for you. I'll push back for you. And I have a friend that's done that. Because I understand not everyone do that. And I was one of those people who couldn't at first, but I got tired of people telling me there's nothing wrong with you. There's nothing wrong with you. And there actually was. So just be persistent. Um, like Nawandi said, if you may not be someone who's comfortable sticking up for yourself in those type of positions, bring someone who you're comfortable with, who will stand up for you. There's been plenty of times when I've been in the hospital and something happened, and not necessarily that I don't want to push back, but I'm just tired, I can't do it. My husband will be like, she told you something and y'all haven't addressed it. He'll say something real quick. Or my sister, she told y'all something hours ago and y'all still haven't addressed it. What's the problem? And sometimes that's just what you need, and that's okay to have that.
Absolutely. You're absolutely right. And I love that. And I guess kind of going from not you as I mean, this probably comes into play as well, because everything we do is integrated in who we are. But as a licensed therapist, Wandi, can you offer us some strategies for coping with things like what Mo just explained, like frustration and medical gaslighting, and when there's like cultural misunderstandings, like how can we cope with that?
I honestly think Mo just answered the question for me. That
Yeah.
is like, we think of like coping with is like the deep breathing and the meditation, and all of that is great. It really is. But sometimes coping is also learning to speak up for yourself. Coping is learning how to lean on your support. Um, Coping is being able to recognize what you have to offer as far as educating people about your condition. That's also considered coping. Um, we were just talking about how education really alleviates a lot of the confusion. Get out here and tell people about what we're going through. That's also coping. And so I tend to come from more of like a empowerment perspective. Okay, what can we do? We are frustrated. Okay. How can we channel that frustration to make sure that we are being heard, we are being seen, and we are being represented in the ways that we need and deserve? Um, Ask for those lab results, ask for those clinical summaries, ask for those my chart results. I need to see everything.
Yes,
I
yes.
need to see everything. Anything we talked about needs to be in that clinical summary. If it's not,
Hmm.
messaging, okay?
Hmm.
So, yeah, I think we have to expand our view of what coping looks like. It is the prayer, it is the meditation, and all of those are equally as important. That's why I always suggest like grounding yourself before you go into these appointments. And also really just practicing grounding yourself in everyday life anyway, but also advocacy.
Okay. I love that because I feel that it makes this all more attainable because it's things that we are doing on our own without even recognizing that that of course not saying that we individually can do the work that a therapist can do with us, but we have these skills within us already. And
Yes.
yes, it's your job to help pull it out of us, but a
Mhm.
lot of things that we're doing are already things that you would recommend anyway. So that's powerful. That's really powerful. Um, as far as for kind of other things like barriers, are there any specific obstacles, whether it's like insurance or transportation, or we keep talking about provider bias or anything like that that you've come across, and how did you handle it so far throughout your journey?
Um, I think one of the biggest barriers, and I'm still working on this, is when it comes to describing pain. They always have this pain chart, but a lot of us who deal with chronic pain or chronic illness, our pain is not that normal 1 to 10. And so I sometimes struggle with how to tell them, my pain is really a 13, but I don't want to say a 13 and you think that I'm looking for medicine or some kind of pain pill, but the pain is really that bad, and I tell people, I say a person's my everyday level of pain is a 5, which would be like a 1 on a regular pain scale. I'm at a 5 every day. So anything over a 5 is, by the time a 10, a regular person's 10 is maybe like a 11 or 12 for me. Like it's up there. And I struggle with whether or not to tell a doctor that, because I do want you to address my pain, but I don't want you to throw pain medicine at it. I like to find other ways than being medicated or overly medicated to deal with pain. And I think that's the one barrier that I'm still, and when I talk to other people, they say the same thing. That's the question, one of the questions that they hate is being asked on a scale of 1 to 10, what is your pain? Because you don't want to say a 10 or 11, or you don't want to say anything over 10, because again, you don't want them to think that you're seeking something, but you really want them to address it. I hate medication. I have so much medication at home that I don't take. I know I probably should, and it would help more, but I can't function. I can't take a pain pill that's going to have me asleep all day when I have a household to take care of. So I think that's really, for me anyway, the main barrier that I'm still dealing with, as far as how to describe pain and how to have my pain addressed, because it's very hard.
Okay, absolutely, absolutely. Um, we've talked a little bit about this when we were speaking about like how we communicate with our loved ones, and when we the amount of help that we seek, and sometimes getting more help than we want or not enough help, and just kind of doing that balancing act. But how would you guys say that we can set boundaries around help, especially when it's our loved ones that really just want to protect us, but we just want to like say, hey, I've got this, I'm still an independent woman, I can do it all, even though we shouldn't always, but we can do it. Like, how do you guys set those boundaries?
I
Wow.
start by identifying what I need,
Okay.
like what my not only my physical needs, but my mental, emotional needs are. So I think it really the conversation about boundaries starts with ourselves.
Mhm.
What do we need? What kind of assistance do we think we need or desire?
Mhm.
And how can our loved ones or our support system help us? So if I can identify what kind of things I need. So for me, I talked about this on the last webinar. We all experience fatigue.
Yeah.
So when I'm on vacation with my friends or my family, I know for me, I'm like, I need a little more rest than a lot of my loved ones. It just is what it is. I can try to push through, but that's not going to be good for anybody. So if I know that's what I need, my boundary is I'm going to take an hour of rest per day.
Mhm.
And now that I know I need that, I can convey that to my family, my friends, whoever I'm on vacation with. And I've been in situations where they build that rest time in for me because I was able to say, this is what I need. So I think, yeah, identifying what you truly need is the first step to creating good boundaries, healthy boundaries.
Absolutely agree with that. And I want to make sure that we have time to, because everyone, like I said earlier, has been so involved in the chat. But Mo, you're living with NMO, and so I want to ask this question to you. So, looking ahead, what would you say is one concrete step our webinar attendees can take um, with learning to strengthen their community?
Um, be open. I know it can be hard to reach out for support, because it's NMO is still it's becoming more known, but it's still pretty much unknown. Not many people know about it, and so reaching out to people may be hard, but it can be one of the best things that you can do for yourself. If someone from Guthrie hadn't reached out to me, I would probably still kind of be in a pit of depression, because I didn't really have, outside of my family, but they don't have NMO, so they don't understand what I'm going through. They can be empathetic towards it, but they don't really know. And so, there's a support group, a women's support group that I'm a part of. And it's one of those things where if you don't want anyone to see you, you don't have to have your camera turned on. You can just sit and listen. You don't have to speak. But there's so much knowledge and there's so much experience. And sometimes you don't realize how much your story can align with someone else. One of the first things I noticed is that a lot of us have the same kind of origin story when it came to NMO. How we felt something was wrong and we were either misdiagnosed or we were dismissed, and the way we were treated by doctors. And again, when that first happens to you, you think you're the only one. So then to find community and find that you're not the only one, there are others that are like you, is so empowering, and it gives you so much strength, and it gives you hope that, when you find out you were diagnosed, you may think, oh, life is over, or I'm not going to be able to do certain things. Some people have this stigma that if you are disabled, that you should be home in the bed under the covers, you don't go out, you don't do anything. People see me out and I thought you're disabled, or the way I've had people follow me when I park in a handicap spot, but I get out of the car and I look okay. And next thing I know, I see them up looking to find a placard in my car. Like, mind your business. But just because I'm not in a wheelchair or I'm not hunched over doesn't mean that I'm not okay. So I implore anybody, who may be feeling alone, to find a support group. Or even, I'm very active. Well, I haven't been as active on social media, but yeah, I am, which is how a lot of people find me. I've gotten so many inboxes from people who go on my TikTok and see some posts that I made and be like, I thought I was the only one. Can I ask you a question? I will answer questions. I have my contact information up there, I have my email, my phone number. I will answer calls. I will answer emails. If you have a question that you can't find the answer to, I will do what I can to try to help you. So find community. I think it's very important.
Mm, that's definitely our running theme for today, community. Finding your community, whatever that means to you. Um, you know, setting your boundaries within your community, within your health network when it comes to your providers. Those are all key things. Today, this has been amazing. I'm gonna be a little biased, but I feel like today has been a little bit better than our last conversation. Like you guys left some key pearls today. So I thank you so much for your openness and your willingness to share your stories and your expertise and everything. So really appreciate it. And I'm sure everyone here does as well. I want to get our audience back involved a little bit before we wrap up. Any questions that you guys have, please drop it in the chat below. And then one thing that I also like to see is what's one action you all plan to take after this webinar? And so while you're kind of putting that here, I've seen several people mention Brandy and say they love what Brandy said. So I want to scroll up and see here. So Brandy said, yes, I have to take my care pack, list of questions / tracker, and my husband to weigh in. So I'm assuming maybe was this when we were talking about appointments. Then Brandy said, then I try to treat myself to a show, snack, or something to look forward to afterwards because I would deserve it. That's right. Absolutely. I'm the same way. I agree with that. Also, Brandy said virtual groups like this have been great for her. It feels like she's not alone in this thing. That's one thing I also appreciate, and I am so glad that it's becoming something that's one thing that I can say a good thing that kind of came out of COVID is the ability for us to do this. And, nothing will beat, meeting in person, but, being able to kind of quickly hop on virtually and, have these conversations has been amazing. Um, be the voice for NMOSD that I've been too shy to be. Oh, I love that. So that's one action that Demo would like to take after this webinar. Nicole says MS Walk support groups specifically for families of color and educate. You're absolutely right. Jackie plans to tell her MS story on a larger platform. Yes. I think that that's one thing for me that I found it took me a minute to even be able to talk about like my story and not cry. So again, Mo and Nwandi, having you guys here sharing your stories. And there was a moment, Mo, when you were talking, I think when you said, not knowing if you'll wake up and be able to walk, I was tearing up over here because it took me back and remember that. And I was in grad school and I would see people on their bikes riding to school and I would get mad sometimes, or I would just cry because I didn't know if I would wake up and be able to do that or not. And so, just kind of hearing the stories. And I had a mentor tell me that because they were like, well, will you share? I was like, I don't have to disclose. I'm not going to say anything. I'm a compartmentalize. That's my business. But, showing that the impact that it could have with my patients and just people in general. And eventually, as I got more comfortable, it's brought me to be able to, sit here with you guys today to do things like this. So for you to have that comfort there, that's amazing. And I know for some it takes time, and some out the gate they're ready to go out there and preach the word. So we appreciate it. Brandy says, re-engage with my local advocacy group. And let's see if there's anything else. So I want to also remind everyone here that there will be a post-event survey. And with the survey for the first couple of attendees, well, no, everyone will be able to, I'm assuming, hopefully I'm not telling the wrong thing, but there's a branded resource box that you can get. So a free gift that you can get if you complete the survey. So that'll come through and please fill it out. It basically allows us or allows We're Ill to get a better understanding of what you guys want to see, what you appreciated from this. Is this something that should be continued? And, how can we better help our communities? And one last thing, Tony says, now I have a better understanding. So now I'm seeking more education on this topic. I love it. I love it. Cheryl, this information has been great for me. I'm dealing with uveitis now that I thought was optic neuritis, trying to find out what is causing this, trying not to lose my eyesight. We've learned, keep advocating for yourself. You've got this, and if you need any guidance or assistance with anything, reach out. And thank you, Nwandi. So she just gave everyone some mental health resources. So Therapy for Black Girls Directory, Boris Henson Foundation, and Open Path. It's a sliding scale resource. Can you tell us a little bit about what that means?
Yeah, so Open Path is a platform where you pay like an initial fee, but then you have options of therapists who will take sliding scale fees, which is basically if you have some kind of financial hardship or you can't afford for whatever reason a therapist's typical fee, or you don't have insurance. It's basically a directory of therapists who will offer, I think sessions are anywhere from $40 to $60, versus, a lot of therapists are self-pay rates are 120, 150, without insurance. So it's a really good resource.
Okay, awesome.
Mhm.
I will definitely note that. I haven't heard of it, so I'll take that down myself to, share with my patients.
I also
I
forgot to put Loveland Foundation. I'm sorry.
Okay.
They have it's specifically for Black women, and you can apply for their therapy fund and you can get 12 free therapy vouchers that are valued up to $120.
Ooh, okay.
You
Yeah,
just
put that
find a
link on there.
therapist who accepts Loveland vouchers. I'm one of them,
Okay.
and you can use those.
Awesome, awesome. And I agree with you, T. This has been amazing. So these last couple of minutes before we go, I'm gonna give it back to you, Mo and Nwandi. Can you guys give us some final words of encouragement?
Um, I think, well, one of the phrases that I use often is disabled, not deceased. Like I said, I feel like people have this stigma about disability and what disability looks like. And being disabled doesn't mean that you can't. Being disabled doesn't make you less than. I actually feel like being disabled is empowering because it shows what you're able to still do in spite of. So I just want people to remember that just because you're disabled does not mean that you can't do something, that you're not worthy of something, that you can't treat yourself. You do what you do for you, and that's all that matters.
Absolutely. What the kids doing? Clock it. That was good. Is it this finger? What? And no,
I feel like I don't know.
somebody told me it was the middle finger, but I always do my index. I don't know, but that was good, Mo. Thank you. And any parting words from you, Nwandi?
Yeah, I want y'all to just know that you are seen and you are value. You have inherent value simply because you are here on this earth. And living with a chronic health condition does not disqualify you from anything you want to do on this earth while you are here. You are still very able, you are still very capable, you are still very gifted. Um, One thing I remind myself, even in the tougher moments, is what wisdom can I extract, even in this season, that I can use to help myself and my community. So, yeah, I think that's what I want to leave you guys with. I have enjoyed you guys so much. I'm sad.
I'm like about to cry again. I'm teared up again. This was so good. I hope you all in the audience got as much out of this as I did. This has been amazing. I did take a little bit of our We Are Ill Family's thunder. We're closing out. I'm sorry, guys, but on their behalf, I will say thank you all so much again for tuning in today. Thank you, Mo. Thank you, Nwandi, so, so much. And again, I just want to remind you about completing that post-event survey, and you will get a treat when you do it. All right. Well, you all have a good evening.
Bye, y'all.